1041. We're on mixtv.tv, and we are joined by our longtime friends from Bradley Medical Center. We have the CEO, Lisa Lovelace. We have Jeanette Fetter. What's your official title, Jeanette?
Chief Quality Officer.
Chief, what now?
Chief Quality Officer.
We have no quality here at this station.
That's why I'm here to remedy that situation.
Oh, boy. Hey, Tom, come get her. And then, of course, Stephanie Austin, Chief Troublemaker. Excuse me.
Yes, thank you.
Of course, Vice President of Marketing. Did I say it right?
Well, sure.
I don't know. I always get it wrong.
I go by whatever title you give me
Oh,
when
really?
I come in here.
Okay.
So
She answers to whatever you say, Steve.
that's right.
That's what she told me.
Steph and I have been together about 20 years now, so I just, whatever. First of all, we've got to call out the obvious here. You ladies look wonderful.
Oh, thank
and
you.
you'll be
Thank
doing
you.
the song, I understand, later. Is
Exactly.
that right?
100%.
Okay, very good. No, very. Well, let's get serious just for a moment here. Of course, like I said, Lisa Lovelace, President, Chief Executive Officer at Bradley Medical Center. So, just to begin, I'd like to talk about the year. It's been just over a year of Bradley Medical Center. Just talk about that, if you would, Lisa.
Yes, I'll be happy to. So in August of 2024, Vitruvian purchased Bradley Medical Center, and we have been so busy at work since that time. We've been replacing beds, working on patient satisfaction scores, also working on ER throughput, which continues to be it's the biggest issue for every hospital, but we continue to focus on those throughput scores. We also have focused on physician engagement, adding physicians, recruiting 18 physicians into the community, which is more than has been recruited in the last 6 years. So we're excited about all of our accomplishments, and we have so much more to go.
Very, very true. And while Jen, I want to ask you a quick question here too. But Lisa, the difference between and this is something that comes up quite a bit, a for-profit hospital and then a non-profit. Tell me about that.
So all of my career, prior to going to Hamilton Medical Center or Vitruvian, that's also part of Vitruvian, in 2021, I had worked for a for-profit hospital system. Of course, CHS, who owned Tenova and Skyridge, regardless of the name change, the ownership was the same, was a for-profit facility. And that simply means that they're publicly traded on the stock exchange, and they are required to have returns for their investors. And so their stock price is something that they focus on. When I was looking at making a change, I really, really wanted to go to a not-for-profit or a non-publicly traded for-profit, just because I felt like that would give more focus on patient care. That means that the money that is made in the community, the services that are rendered, the investments that you make come from those services that you provide. So if you have regardless of what you're making, we either use that money to go back into salaries, we reinvest that into the community, which is very, very expensive when you think about one piece of equipment. I mean, we spend $1 million without thinking twice about it. So a for-profit is really more what we're used to as far as traditional, open trade, fair trade types of things. They are trading on the stock exchange. A not-for-profit keeps all of the profits in this community. We have no shareholders. We return the investment into the services and expansions that we provide and into the employees that work for us.
Can I add one thing to that? And again, I also had a background of a for-profit healthcare career. And I know Jeanette started with not-for-profit as well, so she can go back to that. But for me, we launched immediately working to make improvements. We opened the Women's Imaging Center. I mean, that had been on our plans for 10 years, if not longer. But the key for me when I realized there was a difference was when it was, let's do a community health needs assessment for Bradley and Polk County. And that was when I realized the true commitment was bringing key leaders together, finding out where we can make improvements, how do we reinvest that money to go back into these communities and surrounding areas.
Well, and I'll just add to that as well. The community needs assessment that was done this year, and Stephanie led that project, is a requirement of a not-for-profit facility. You have to do that every 3 years, I think, is the cadence. And so looking at what the community needs, and then I have continued to have conversations with the chamber about, okay, we had the needs assessment, there was very good participation. What are we going to do to execute on those plans outside of the hospital? Because it is a community needs assessment. And so the community leaders come together to try to solve those issues and use that plan as guidance.
Jeanette Fetter is, again, the Vice President and Chief Quality Officer. And, talk about your experience and of course, the long-time commitment to excellence that you've seen.
So I've had the pleasure of working at the address for 41 years. And I started my career in not-for-profit, which was Bradley Memorial Hospital, and I had 21 wonderful years with that. And then I had 19 interesting years with community health systems, but I learned a lot, and I'm grateful for that. And now we're back to not-for-profit, which has brought a lot of our past Bradley Memorial Hospital leaders to join in partnership with us because they're very excited about that. What I saw in not-for-profit is strategy was based on a quarter. How much are you making this quarter? And if you're not making it, can you reduce staffing? Can you not buy certain supplies and certain pieces of equipment? And that was pretty distressing to me because healthcare is a mission. It's not just a job. And I was able to stay through those 19 years by focusing on if I can help one patient, one provider, one community member every day, preferably more than that, I can get through these 19 years, and I made it through that way. So now it's very, very exciting to me to come to the closer end of my career in a not-for-profit that is very, very much invested in us. So much so that in the very first month, they bought us $2.5 million worth of beds. Now, that sounds maybe a little silly, but our beds were so old that they didn't even make equipment to fix them anymore. We couldn't repair them anymore, and our guys can fix anything. But that's how draining that was to meet that stock price.
Wow. Jeanette, also, the hospital, you have your first ever patient experience director, and your scores have improved so much. Is that right?
Yes. So one of the first things Lisa wanted me to work on, and all of us to work on, was our ER wait times and our patient satisfaction scores. So we hired Jeremy Johnson, who has worked for SeaWorld. He's worked for Disney World. He's built programs for hospitals. He just jumped right in. He fits perfectly, loves our community. And our scores were significantly low. Press Ganey, which is a national surveying company, has a national database that we can peer reference against. And we were very, very low in our percentile rankings. And we have increased our ER scores and our inpatient scores by double digits. Press Ganey says if you just increase by 6 digits, you're in the top 10 percentile of a company for the year in improvement. And we've done 3 times that. Wow. Yes, sir.
Wow. And also, Lisa, maybe a little more about the ER.
Yes, when we look at the ER scores, they have dramatically improved. I want to say just a couple of things as well, though. We have averages that are published, but if you happen to arrive when there's a motor vehicle accident and there are 4 or 5 people that is going to skew that score. But we continue to look at opportunities to improve those throughputs. So one of the first things that we did was add additional staffing to both the ER nursing staffing as well as the physician staffing. Another thing that we did, and we talked about this on the show before, and we finally got this done in September, October, we have opened the 5th floor that gives us more beds to move the patients to. We have a daily huddle where we talk about all of the pain points that cause a problem with throughput, and we've identified 3 more opportunities that will help to continue to reduce that. As a part of our plan, though, from an ER expansion standpoint, in the 10-year plan that we've been putting together, one of the things that we wanted to do is reopen the West Side campus as far as the ER beds are concerned. If many of us remember, that's where I started, and it was an ER. And so when the 2 facilities came together, we had that open for quite some time as basically a freestanding ER that was connected to the main hospital. And so as a part of the Siskin project, we had planned to reopen that, but of course we had to get everything together with Siskin first, and now we're proceeding with those plans to reopen that West Side campus.
Certainly so. And Jeanette, I want to go back. We're talking about the ER
Yes, sir.
and the wait time improvement, which is really tremendous.
Yeah, it's been significant, opening up the extra beds, and we needed to hire, we had 200 empty staff positions. Largely, most of those were nurses that we had not been allowed to fill. All of those were filled. And so then we all came together to look at our ER times, and our inpatient ER wait time was running at that point around 700 minutes, which is way above the national average for our size, which is about 250 minutes. We've reduced that now to where we're running around 250 to 300. We want that lower, but in 1 year, we've managed to do that. Our door, treat to street is what they call it, from the door you come in till you go back home, was running around 400 minutes. That's running around 150 minutes now. Of course, there are always exceptions, like Lisa mentioned. If you come in and there are 20 people that have just came all at the same time, it's going to take a little bit longer, but the folks that are the most acute are the ones that are going to be treated the fastest.
All right, we are joined this morning by our friends from Bradley Medical Center. Again, we have Lisa Lovelace, President, Chief Executive Officer. We have Jeanette Fetter and friend. Oh, wait. Stephanie Austin,
Here I am.
my friend. Stephanie, anything you want to comment on what we've been talking about here?
I think the other thing, again, coming from the for-profit arena to now with the not-for-profit is, and Lisa and Jeanette can go into more detail, we've had a total of over $260 million of reinvestment back into the community, again, within 1 year. And so that's another tribute to, I can honestly tell you that has not happened in my career. And so to watch the commitment that Vitruvian and now having the not-for-profit status of what we're able to do back into the community and grow to meet the healthcare resource needs.
And talking about that, and I know we've talked about orthopedics, which we had the doctors in. I know you're very excited about that. But as much as you can, talk about the physical area. A lot of people in Cleveland talking about the land area around the hospital. What can you tell us?
I can tell you that that's a part of our 10-year plan, and some of the things that we're looking at are adding services or enhancing services such as the Women's Center. We need an upgrade. We need to look at that opportunity. Looking at a surgery center because we need more access for surgery centers and to partner with the physicians to do that. We're looking at medical office building space around the building. We are looking for opportunities to, partner in areas such as oncology. I can also tell you that one of the things that we're doing that's really not about a physical expansion around the building, but also a service enhancement, is that we are going to have an inpatient neurohospitalist program, which what that means is we'll have a neurologist who is in the building at least 12 hours a day, and then they'll be supporting after hours with after hours support. It's the number one transfer out of this community, and we want to keep those patients here closer to home in order to receive that care. So we're very, very excited about that. We have purchased about 12 acres around the campus so that as we're looking at this 10-year plan, we can look at opportunities for service development and bringing more and more services into this community.
Jeanette, anything you want to comment on as we're about to wrap up here?
I'll just say that Vitruvian has an excellent mission, vision, and pledge for our community and for our associates. And that is, we serve with compassion, and I have seen that. I told Lisa I'm cautiously optimistic about this purchase. I've been through a lot, and I have been overwhelmed. This is a company that serves with compassion, and our pledge is excellence, every person, every time, and I'm seeing that every moment, every day, from the time I walk in the door till I leave, and even with the phone calls I get at night that I need to help folks with. So it's been a pleasurable experience.
And I think the other thing is we're very transparent. We are transparent. And so if anyone has any questions or opportunity for improvement, we ask that you reach out to Bradley Marketing at vhcs.org, and we would love to get that addressed because we do want to make this the community hospital that people are proud of and can watch it grow as we grow together as a community.
Before, and Lisa, I want to wrap up with you and talk about the future and more about the future. But I do want to talk about something in the news this morning that we have, and that is your negotiations with United Healthcare. It's, like I said, in our news this morning and the news around the area. What would you like to, what can you say about that at this point?
I will say up front that I'm limited in what I can say, but I will say to you that we are just as frustrated as the consumer. We are just as frustrated as all of the community. I mean, we've heard so many comments about United Healthcare. We continue to attempt to negotiate a plan in the community. I will also mention that while United is not going to say this, we are turning no United patients away, even for services that are out of network that can't get a pre-authorization. There are some tricks around that. United's not going to tell you that, but we are taking that on. And, as frustrating and as much as it keeps me up at night, that's the thing that keeps me up at night right now. I can tell you that we're doing everything we can to take care of those patients right here, right now, while we continue to fight this battle. We'll also reference the press release that came out today. There's a lot more information there that can be helpful, and I would advocate that if you have United Healthcare, call the insurance commissioner, call United Healthcare. We have call to action opportunities that's listed in that press release. And this is unprecedented to see a company put a press release out like this. I've worked in healthcare for a long time. Stephanie's worked in marketing this way for a long time, and it's a first for us. And we're so glad to be able to be so transparent with you all about where we are today on that very sensitive and difficult topic. Thank you for asking about that.
Absolutely. And and just one more comment maybe about the future, and I know you've talked some about that here, but things you also have had in motion for quite some time.
So joint venture with Siskin is a big deal. That's coming in the fall. That's going to revitalize the Westside campus. We're also going to be looking to add those services at the Westside campus, as we talked about. Looking at the future, serving that the neurology program and having inpatient abilities inside that hospital without transfer. Looking at ICU, critical care, we're looking at those opportunities as well. Looking at bringing more neurologists into the town, as well as endocrinology. We've recruited, as we talked about, 18 physicians. Those include some services that we haven't had before. An orthopedic hand surgeon that's fellowship trained, Abby Halpern, she's here. We've brought in an ear, nose, and throat physician who is also here. We've brought in an endocrinologist. Those are all new services to our area that wasn't here a year and a half ago. And we are continuing to try to bring those services back to town. I'll also mention that we have also recruited 3 OBGYNs, and we all know in Cleveland that has been challenging for us for a little while. We're not finished with that, but we're excited about what we've been able to accomplish, and know that we will have a very, very strong OBGYN program and presence with the physicians that we have and that are joining our staff.
My mother was visiting a patient on Sunday and told me to tell you she loves your Christmas trees.
Oh,
so,
thank you.
Love that.
Stephanie, that's been a big hit, hasn't it?
I know. Who would have thought that would turn out to be that way? But again, we want to thank the whole community. We've seen a lot of people posting about it, and there is something about just seeing the children look up at the different trees. And if you want to know how talented our staff are, those are not professionally decorated. That is done by the departments who probably have people that could do it professionally, but it is really tremendous, and it really does kick off our holiday season.
All right, Stephanie, I am going to finish up with you. How do people get more information about all of this?
I think if anybody has questions, the easiest route is to go to email bradleymarketing@vhcs.org, and we can get you to whatever department your question is about, so that you're not having to be transferred to different locations. We'll reach back out to you directly.
And of course, the website also.
Absolutely, vitruvianhealth.com.
vitruvianhealth.com. Ladies, thanks. Merry Christmas.
Merry Christmas.
I hope you enjoy, Jeanette, your karaoke time. We're going to do that. She's already threatening me here this morning. All right. Tell you what, we're going to take another break. We're getting a lot of